Welcome to the Medical Minute with Dr. Ray Andrew. Today's Medical Minute is about breast cancer risk reduction. This morning, I ran across a draft recommendation that is under consideration by the U.S. Preventive Services Task Force. This task force is a group of experts who evaluate the evidence regarding a specific diagnosis or treatment procedure and its effectiveness on a specific health condition. In this case, the U.S. Preventive Services Task Force evaluated the current evidence regarding the role of medications in preventing breast cancer in high-risk women. The backdrop of this recommendation is that an estimated 1 in 8 women will develop breast cancer at some point in their lifetime. Obviously, that's a big deal, and although it doesn't hold a candle to the amount of death from coronary artery disease in women, it's still on every woman's mind. Based on its review of the evidence, the task force recommended that clinicians offer to prescribe risk-reducing medications such as the breast cancer drug tamoxifen, raloxifene, which is Evista, or aromatase inhibitors such as letrozole or Femara, to women who are at increased risk for breast cancer. The USPSTF found that medications such as these drugs can reduce a woman's chance of developing invasive breast cancer. Sounds great. However, the task force said these medications can also lead to serious harms, some of which may be life-threatening. Women at greater risk, such as those with at least a 3% risk of breast cancer in the next 5 years, are likely to derive more benefit than harm from risk-reducing medications and should be offered them if their risk of harms is low. Tamoxifen, in particular, was found to reduce the incidence of invasive breast cancer by 7 cancers for every 1,000 women during a 5-year period. Raloxifene, by contrast, reduced the incidence by 9 cancers per 1,000 women over 5 years. So, and then they conclude, for women with a predicted breast cancer risk of 3% or higher, the absolute benefits are likely even higher. They make that sound as if that's a stunning deal. Aromatase inhibitors, such as Femara, were found to reduce the incidence of invasive breast cancer by 16 events per 1,000 women during a 5-year period. Tamoxifen and raloxifene increase risk, however, for blood clots, venous thromboembolic events. Tamoxifen increased risk of endometrial cancer and cataracts. And we can't ignore vasomotor symptoms, meaning hot flashes. Then they say for aromatase inhibitors, the harms were small to moderate, including hot flashes, gastrointestinal symptoms, muscle pain, bone pain, and possible cardiovascular events such as stroke. No big deal because we're preventing breast cancer in 16 out of 1,000. The draft recommendations noted that aromatase inhibitors, however, may even increase the risk of fractures. The medications are not perfectly effective, with a number needed to treat of about 63 over 5 years for aromatase inhibitors and 100 for 5 years of tamoxifen or raloxifene. So let's put that into perspective. What does that mean for you? Well, it means that according to the current evidence, 63 women need to take an aromatase inhibitor like Femara for 5 years to prevent one single case of breast cancer. The other 62 women who are taking that drug for 5 years derive no benefit and, in fact, experience side effects. And for tamoxifen and raloxifene, it takes 100 women taking the drug for 5 years to prevent one single case of breast cancer. Not exactly a stunning result, a stunning risk reduction. So who are these women with high risk, meaning at least a 3% risk of breast cancer in the next 5 years? Well, let's go to the Breast Cancer Surveillance Consortium Risk Calculator, which gives us both 5 and 10-year breast cancer risk estimates. This calculator is not applicable to women who are younger than 35 or older than 74, who've ever had breast cancer, who've ever had DCIS, which is not breast cancer, who've ever had breast implants, or had a breast removed. So we will say no, you don't have any of those conditions for the sake of argument. Let's say that you are 57 years old. Let's say that you're white and neither your mother, sister, or daughter has been diagnosed with breast cancer. We're going to say no. And let's say that you've had a biopsy, a breast biopsy for an abnormal mammogram before, but it was found to be benign. And let's say your mammogram shows that your breasts are heterogeneously dense. On examination, that means you have fibrocystic breasts, which we find at an unbelievable rate in America today. Most women, I find, have heterogeneously dense breasts on mammogram or fibrocystic changes on breast examination. That's all the same thing. So let's calculate your risk now. It says your risk for developing invasive breast cancer over the next 5 years is 2.51%, and it goes up to 5.25% over 10 years. So over 10 years, your risk is 1 in 20. And the 5-year, let's say the 10-year risk for a woman the same age, 57, and white, without having had a breast biopsy before and not having fibrocystic breasts, is a whoppingly reduced rate of 3.54%. So truly, I should be considering you for one of these drugs. Now let's look at some of the side effects. Evista, common side effects, these aren't rare, include hot flashes, sweating, headache, dizziness, spinning sensation, that sounds like fun, leg cramps, joint pain, nausea, vomiting, stomach pain, runny nose, or infrequently, stroke or blood clots. No big deal. Let's take a look at tamoxifen now. First we need to make sure that you're not taking Wellbutrin, Prozac, Paxil, Cymbalta, Zoloft, Benadryl. Those are drugs that are going to interact with tamoxifen in the liver. Okay, side effects: vaginal bleeding, leg swelling, chest pain, shortness of breath, weakness, numbness, vision problems, dizziness, severe headache. But those aren't the most common side effects. The most common ones are bone pain, hot flashes, nausea, fatigue, mood swings, depression, headache, hair thinning, constipation, loss of sex drive. Sounds great. Oh, this is really good. It says a 2008 British study suggests that women who experienced hot flashes and night sweats while taking this drug were less likely to have the breast cancer, if they had one, come back. So in other words, if you had breast cancer and you're taking tamoxifen and you get hot flashes or night sweats, that's a good sign. You should count yourself lucky, because that means you're less likely to get breast cancer again. So this will help you stay on that awful drug. Oh, and by the way, some women on tamoxifen have reported memory problems, but we haven't proven it yet. Awesome. Let's take a look at Femara. Femara is recommended also to be taken on a daily basis. And what do we get with Femara? Hot flashes, hair loss, bone pain, muscle pain, tiredness, night sweats, nausea, diarrhea, dizziness, trouble sleeping, drowsiness, weight gain, weakness, flushing, pain in your hand. Not a big deal, right? So, in all fairness, this is just a draft recommendation statement and review of evidence. It hasn't been finalized yet. It's open for comment. But chances are really good that it's not going to be changed in the final announcement, the final recommendation. And so you and your doctor need to make an evaluation based on your risk as to whether one of these drugs is something you should take to reduce your risk of breast cancer from 3% or 5% to maybe 1% or 2% using one of these drugs, realizing that either 63 or 100 people will have to take one of these drugs for 5 years for one of them to receive benefit and the rest to only be exposed to the harms. This is Dr. Ray Andrew, and this was today's Medical Minute. Thank you for listening.